Urban Talk would like to acknowledge the traditional owners of country throughout Australia and the traditional owners of the land on which we record this podcast, the Gadigal of the Eora Nation. We recognise their continued connection to country and pay our respects to elders past, present and emerging. Welcome to the Urban Talk podcast, the show where we bring together communities, planners, developers and fresh ideas to shape the cities we all call home. Urban Talk is all about bridging the gap between the industry professionals building our neighbourhoods and the communities living in them. We're here to make conversations about urban development transparent, accessible and we hope exciting. In each episode, we'll unpack the issues, challenges and visions that shape our cities. I'm your host, Belinda Barnett. In our previous episode, we spoke about how green infrastructure and active transport can improve livability. In this episode, we'll examine some initiatives by the Heart Foundation of Australia to improve public health and livability. Research shows that there is a strong nexus between the design of our neighbourhoods and the health of our communities. The Healthy Active by Design program and the Community Walkability program that the Heart Foundation of Australia have developed is an important body of work that is backed by evidence-based research. These programs are directed at planners, architects, engineers, local government and community members, and they are all about ensuring that the design and development assessment decisions we make today deliver the best livability and health outcomes for our communities both now and into the future. Today, I'm delighted to welcome Anna Gurnhill from the Active Living team at the Heart Foundation to learn more about the exciting work in this area. Welcome, Anna.
Thanks so much, Belinda. It is lovely to be here with you and your listeners.
Congratulations on the great work that the Heart Foundation is doing in promoting healthy design outcomes. To start our discussion, can you outline how our built environments influence public health and why walkability is so crucial?
Yeah, absolutely. And look, this is a fantastic starting point. Built environments influence public health in lots of different ways. There's a growing recognition that one of the strongest predictors of life expectancy is our postcode. And that's because our built environments shape the way that we live our lives, including how much physical activity we get and our access to fresh, healthy food, which of course is something else that's so important to the work that we do at the Heart Foundation. I like to think of the relationship of built environments and walkability in the way that if you imagine your likelihood of walking to the local shops or park or library, community service, if it's a safe and pleasant walk within a short distance of your home, but then imagine the same scenario and your likelihood of walking to some of those destinations if they're located further away, if you've got to cross busy roads to get there, if there's little greenery, there's no shade, there might be fast-moving, noisy traffic. If it's not enjoyable and pleasant, we're a lot less likely to do so, either from a choice or from actual ability to be able to undertake that walk. So walking really should be an easy, affordable option for most people to be able to incorporate physical activity into their daily life. It's one of the most accessible forms of exercise, and it really should be as easy as stepping outside the door for most people across Australia. To your next point on why walkability is so crucial, and particularly from our interest at the Heart Foundation and the work we do in cardiovascular disease and reducing disease risk factors, we know that more than 77% of people in Australia, and adults in particular, don't meet national physical activity guidelines. And this is about those 30 minutes of physical activity every day combined with strength exercises. We know that physical inactivity is calculated to cost Australia $2.4 billion each year in additional health costs alone, and that physical activity is a key preventive action for cardiovascular disease, together with having a healthy diet and maintaining a healthy weight. So this is a really simple thing that most people in Australia should be able to do to look after their own heart health, as well as other physical health benefits and mental health as well. At the Heart Foundation, of course, we've got a particular vested interest in this. Cardiovascular disease remains the cause of 1 of 4 in all deaths in Australia. And that's a number that's just way too high when there are relatively easy actions that people can take if their built environment supports them to be able to do so. So we know that number can be reduced. And we also know, though, that it's not just the responsibility of an individual to start making those lifestyle changes. We also know that it is shaped by the environment where people live. And this is why we developed the Healthy Active by Design resources. Research shows that people who live in walkable communities are 1.5 times more likely to get sufficient physical activity for heart health. And we also know that people who live in walkable neighbourhoods are 2.8 times more likely to have a healthy cardiovascular risk profile than people who live in neighbourhoods where walking just isn't safe, conducive, or easy. And just to explain briefly what I mean by walkability, in case it is a new term for some of your listeners, it's the extent to which an area supports and encourages walking and wheeling. And we say wheeling to be inclusive for mobility aids, wheelchairs, and other assisted walking devices. And walkability, it's more than just the footpaths. Yes, they're an important element, but it's also about the way that an area makes someone feel. Is it safe, enjoyable, amenable, including for people of all ages and abilities and at different times of day and night? Is there shade cover and amenity, places to stop and rest? And that can be particularly important for different age groups and the elderly in particular. Are there points of interest along the way? Is it possible to access some of those local destinations easily within walking distance? Is there separation from other transport modes? There's a whole range of different elements that contribute to making those built environments more walkable. So look, it really is crucial to enable people to get those 30 minutes of physical activity into their everyday lives.
That's a great explanation, and it certainly, I guess, grounds it as to why it's such an important aspect that planners and designers need to be having regard to in their day-to-day work. So let's talk a little bit more about the Healthy Active by Design program. I guess the work that you're doing now, and you shared with me when we were getting ready for the podcast, first originated from a collaboration between the Planning Institute of Australia, the Local Government Association and the Heart Foundation back in 2008. And the commitment to embed better public health outcomes into the built environment is a very long-standing one, and it's now under, I think, pretty much completely under your watch, and you just keep gaining more and more momentum, which is absolutely fantastic, and thank you on behalf of all of us. Can you tell us about the Heart Foundation's Healthy Active by Design program? Because I know there's 8 essential features that underpin it. It's what its overarching objectives are.
Yeah, absolutely. Look, as you say, it's a program of which we are very proud in the Heart Foundation because it does have that strong legacy and really strong involvement from key stakeholder organisations like the Planning Institute of Australia and the Australian Local Government Association. We're very thankful that we maintain really strong working relationships with both of those two organisations. We're also really proud that it's an award-winning digital toolkit and that the unique point of difference about what Healthy Active by Design does is bring that evidence-based approach to embed public health outcomes into urban design and built environments. So the toolkit, as you've said, it contains many different resources, including those 8 design features. And the objective is to try and help particularly practitioners, industry practitioners and elected leaders and decision makers to shift awareness and attitudes to support the design and delivery of more walkable, livable, built environments and local neighbourhoods across the country. It's intended that it's applicable for new growth areas as well as established suburbs, and that it is applicable in both urban and regional contexts across the country. You mentioned 2008, and that's when this program first commenced as that partnership with PIA and ALGA. And since then, we've been working with leading academics, researchers and other practitioners to build out the materials. And we're constantly making sure that we update and enhance the resources that are available so that they're reflecting the latest research and evidence and best practice both nationally and internationally. In addition to the 8 design features, which I can talk a bit more about shortly, we also have a wealth of publications and policies available on Healthy Active by Design. We've got 2 supporting modules, which I can talk a bit more about. We've got an introductory training resource. We've got over 100 different Australian case studies and international examples as well. So these are really great stories of success, of local councils and others who've been there and done it before. Really inspiring stories to help others on their journey, as well as being able to showcase and promote some great work that's happening nationally and internationally. And the resources are all presented in such a way that effectively what they do is translate that research and evidence on walkability and for heart health outcomes into practical guidance for industry practitioners and decision makers. So our key audience for these resources, and thank you for touching on those, it's urban planners, transport planners, traffic engineers, public works and asset managers, architects, landscape architects, basically anybody who works in an industry that has ability to influence outcomes of the built environment for their local communities. And of course, importantly, that includes elected leaders and executive decision makers at all levels of government.
Fantastic. Well, let's drill down on the 8 key design features. So do you want to walk us through those?
Yeah, absolutely. Thanks, Belinda. So the 8 key design features touch on the key elements and core factors that really contribute to whether or not built environments are walkable. And these are public open spaces, community facilities, buildings, destinations, housing diversity, movement networks, sense of place, and healthy food. And each of these design feature has a wealth of information that sits within that feature on the digital toolkit on Healthy Active by Design. They're all formatted in a similar way and follow a similar structure so that it's really easy for somebody to navigate through that toolkit and find exactly what it is they're looking for. Each one presents information on the health impact and evidence that links that feature or topic with heart health. It basically presents the why and the rationale and importance for the design of that feature from that heart health lens, which of course is so important to us at the Heart Foundation. For example, the health impact and evidence on public open spaces notes that these spaces support physical activity by providing destinations for people to be able to walk to, and also facilities to host a wide variety of different community activities and physical exercise as well. It also points to the evidence that people who use green public open spaces are more likely than others to achieve recommended levels of physical activity across their week. And the evidence, by way of example, for a design feature like public open spaces also talks about the importance of the quantity and quality of public open spaces to achieve those health benefits. And then for each design feature, as well as having that health impact and evidence, we have a number of different case studies and international examples. And then back to my earlier point about how we translate this body of research and evidence into practical guidance for industry practitioners and decision makers. Each design feature then also contains a checklist, and the checklist picks up on the information that's been provided through the research and evidence and is a tool that can then be used by practitioners and local councils to undertake an assessment or an audit of an existing suburb or neighbourhood or a proposed new project, and just assess how that project or area stacks up against the evidence that's provided to help create a walkable built environment for that particular design feature. So each of the checklists, they're tailored for the specific design feature, and they all provide a clear objective for the purpose of that design feature. They have a number of associated principles that draws from that evidence base and then provides specific considerations against which to assess a project or an established area. And these can be really helpful in guiding project outcomes.
Yeah, absolutely. I pulled out some of the evidence-based statistics or features from some of your publications, and I might share a couple. I mean, you'll know them all, but I found them to be quite very, very interesting. So one of them was adults with a wide range of green spaces around their home report 37% lower hospitalisation rates and 16% lower heart problems. Residents with larger neighbourhood parks within 1,600 metres from their homes engage in an additional 150 minutes of recreational walking per week than those with smaller parks. I mean, these are great principles to actually keep in mind, when you are looking at a neighbourhood and looking for improvements. I mean, I found some of the stats to do with, I guess, mixed-use zonings to be really interesting. So each additional kilometre walk per day in mixed-use environments is associated with a 4.8% reduction in the likelihood of obesity, and an increase in land use mix is associated with a 12.2% reduction in the likelihood of obesity. I mean, these are really important things. And, planners sitting there looking at doing their local environmental planning maps and making decisions about zonings, to have this sort of evidence-based health statistics in your head at that time, it's really cool to know that these sort of decisions can have these other implications that we most probably didn't think of, years ago when we were colouring out the maps. I find it fascinating. I love the evidence-based decision making behind your research. From your research, not from behind your research, but from your research that is going into the work that you're doing and to the toolkit. It's very good. People with access to a main street centre are over 7 times more likely to walk for over an hour each week. I mean, there we go, again, reinforcing the importance of Main Street.
Absolutely. And look, it's really important to us at the Heart Foundation. We are an evidence-backed organisation, so it is really important to us to have that information and to have that research. And we hope that local councils and practitioners will be able to build that sort of evidence base and rationale into their business cases and budget bids. And it really does help to build the picture for change.
Yeah, and I think it's really important. I mean, we'll talk in a little bit about active transportation initiatives, but, when I was preparing for our podcast, I was thinking that often when elected representatives or planners, bring up, the notion of removing curbside parking or widening footpaths and bringing in cycleways, which usually mean that you're going to lose a lane of traffic, it's met with a lot of opposition. But I don't find that often, well, not in my recollection or the experiences I've had, I haven't seen health data put out there when these decisions are being talked about with local communities. And I can't help feel that if this sort of health data was put out there and discussed at the same time, that we may be able to reframe attitudes towards these types of initiatives.
Absolutely. Look, there's a great opportunity there, and I think it's a quite unique position that the Heart Foundation occupies to be able to make that compelling case from a health perspective. And yes, I think we as an industry need to get better at telling that story and creating the right messaging that resonates across communities and helps to counter some of the opposition that you've outlined that can often come to the fore when proposed changes are put forward.
Yeah, I can't help but think, but start including this type of information as part of those broader community conversations. I just think it's absolutely essential, particularly since we now have the evidence from your research.
Absolutely.
Let's talk a little bit more about the toolkit. How adaptable is the Healthy Active by Design toolkit for addressing the needs of, say, more diverse populations such as older adults and disadvantaged communities?
Yeah, for sure. Look, we've done a bit of work in this space in recent years to further supplement those 8 design features. And as part of that work, we've actually developed 2 new supporting modules for Healthy Active by Design. One of these is Healthy Active Aging, and the other is walkability in less advantaged areas. And both of these areas of work have recognised that there are specific nuances for some of these priority population groups that apply regarding the walkability of those built environments. There are specific barriers or unique circumstances that can add further complexity to whether or not the ageing and people who live in areas of lower socioeconomic advantage are likely to get that physical activity. So because of that, we've sort of gone out and developed these 2 new supporting modules that almost sit as an umbrella over each of the 8 design features. And those supporting modules, they're formatted and structured in a very similar way to the 8 design features, and they're applicable across all of the 8 design features. But they really look at some of those sort of unique circumstances. So by way of example, walkability in less advantaged areas, which is a module that we launched just in November in 2024. This circles back to some of our opening comments around health being very much tied to a person's postcode. So we know that people who live in neighbourhoods of lower socioeconomic advantage tend to be less physically active and have poorer health overall than residents in more advantaged neighbourhoods. So we wanted to explore this in a bit of detail and sort of look at, what's happening in these neighbourhoods and how do we get to some of the root cause of this, and what can we do from that Heart Foundation and Healthy Active by Design lens to try and overcome some of what's at play here. So we worked with researchers from University of Canberra and 3 communities in less advantaged areas across Australia, and we identified those areas based on the Australian Bureau of Statistics CEFA rankings. So we worked with one community in inner city Perth in WA, one community and council in Western Sydney, and another one in a regional area in Tasmania. And we visited those communities and held workshops with community members, with council members and staff and other practitioners to look at exactly what was happening there and why are there lower levels of physical activity and walking in these environments, and specifically what role is the built environment playing here in barriers, but also some opportunities. So based on the results of those workshops and together with academic researchers, we developed the new module, which is now available on Healthy Active by Design. Similar to the design features, it presents the health impact and evidence and also some of those sort of stats that you were commenting on just now. It looks at the particular nuances, and the checklist for this particular module really delves into considerations for how to overcome some of those nuances, and some of the things that we identified that were particular to areas of low socioeconomic advantage are around things like safety, lighting and passive surveillance, opportunities to attract private investment and try and help shift some of the reputation and sense of pride within the communities themselves, opportunities to reduce travel distance and time, and particularly from outer areas and coming back to our community in Western Sydney, the need for diverse housing options across a range of different price points in these communities, and also looking at limitations on the number, location and advertisements of unhealthy food items, as well as improved opportunities for social connection within these communities as well. So some really interesting nuances. And look, that's 2 particular population groups that we have looked at. There are more as well that could be developed further.
Let's talk a little bit more about the evidence papers and case studies. I love hearing case studies. They make everything work for me. In the preparation of this episode, you mentioned that the Heart Foundation has been working, and you've mentioned it just recently as well, with academic researchers and other professionals across the world in developing evidence-based papers. Can you describe some of the upcoming evidence papers that you're going to be publishing?
Yeah, absolutely. And look, this is a really great opportunity as well for me to give thanks to the many, many researchers and academics who have been involved with Healthy Active by Design since its commencement back in 2008. The program would not be what it is without significant contributions from many leading experts in fields related to walkability and the built environment. So we're really pleased to be able to continue those relationships and continue to use Healthy Active by Design as a way of promoting some of the amazing research that's happening across different academic institutions as well. So we've recently launched an updated evidence paper on active school travel, and this is live on Healthy Active by Design website under our publications page at the moment. The paper, we have previously had an evidence paper on active travel to schools. This paper that was launched just in recent months updates the evidence on the importance of active school travel for students, and it discusses some of the barriers and provides recommendations for improvement. And I can talk a little bit more about that shortly. In addition to that paper, we're going to be releasing a further 4 evidence papers in coming months for an update on designing for density, a new paper called The Heart of Road Use, an updated paper on good for business, and this speaks to some of what you were just talking about around changes and improvements for main streets and town centres and how those changes can benefit local economic outcomes, and an evidence paper that's a sort of a general, almost bread and butter type paper for us on walkability and the built environment at its most fundamental sort of levels. So the paper for Designing for Density updates previous work in this space, and it makes the case for the need for increased density across Australia. The paper notes that many of our cities in Australia, including in Adelaide, Canberra, Melbourne and Sydney, have densities that are too low to support walking, and suggests that most of our towns and cities across Australia would benefit from increased densification for walkability and heart health purposes. So the paper talks about the need for increased density, done well, to support heart health, and it makes a number of recommendations. It provides some really clear guidance on what those appropriate sorts of levels of density might look like in different contexts across the country. The Heart of Road Use is a new paper, and the title of this one is a little bit of a play on words around heart health and road use allocation. So this paper will provide a people-first approach to embed health in transport planning. So putting people first as we plan and redesign our city streets can reduce barriers to active travel and improve heart health. It provides opportunities for physical activity through walking, cycling, catching public transport for those everyday activities and short journeys. So we know that there is opportunity across the country for transport and infrastructure to prioritise health of residents and visitors and to reduce dependence on cars for daily activities. The paper explores the history of road use, and it demonstrates how our road use has shifted over time in parallel with urban sprawl and car dependence. And it provides a compelling case and recommendations for action to reprioritise traffic engineering and transport planning so that we start to again focus on a healthy transport hierarchy that really starts with prioritising people walking and wheeling, bike riding and using public transport. So this is one that we will be launching, we anticipate in early September, and it'll be a new paper for us, and really excited about that one. Good for Business is an update to a 2011 paper of the same name, and it makes the case and helps bust some common myths to support the notion that making town centres and main streets more walkable isn't only good for heart health, but it does support those local businesses in those areas as well. The paper presents evidence on the expenditure per person according to their arrival mode, whether that be by foot, bike, public transport and private car. It draws on case studies and examples nationally and internationally. It discusses the controversial topics that you've raised, Belinda, around road space reallocation and reducing some car parking in business districts to support more active and public transport, as well as supporting outdoor dining and other people-oriented activities. So this is going to be a really great paper that we'll be launching in coming months. I encourage all your listeners to follow Healthy Active by Design on LinkedIn, and that's where these papers will be first launched and released. So if you want to be first to know when these papers are available, follow Healthy Active by Design on LinkedIn.
Fantastic. Would you mind sharing some case studies? Because I know you've been talking about the active transportation with the schools. And again, there's I believe, Marybeck City Council active school travel has been a bit of a featured or a very successful case study of the Heart Foundation. Can you share with us what happened with that particular initiative?
Yeah, absolutely. Thanks, Belinda. So Marybeck Council, together with Bicycle Network in Victoria, have been doing some really great work around active school travel. And this is a case study that we highlight in that evidence paper for active school travel. Marybeck Council, together with Bicycle Network, have worked with 10 primary schools across the council area to improve rates of children's active school travel. And the way that they've gone about this is through a trial project where they have closed streets surrounding the school gates on one day a week for 3 weeks. And in closing those streets to vehicular traffic, they've effectively opened the streets up for other opportunities. And they have, coinciding with the closure of the streets for traffic, have opened up the streets and brought them to life for other uses, including not only just through allowing children that greater opportunity to be able to walk and ride on streets that are closed to traffic, but also through other activities that promote social play. The trial projects across those 10 schools has all been really well supported and very successful. Importantly, even the local residents are primarily supportive of this program to encourage more children to walk and ride to school. And results have shown that on the open street days, there's around a 19% increase of students walking or riding to school, and that represents about 70% of students walking or riding to school on those days, which in our Australian context is huge. So these are really, really encouraging results to see, and a great initiative that's been implemented here by Marybeck Council and Bicycle Network in Victoria. Across the country, there are other similar programs that are happening. I think it's fair to say there is an increasing recognition that we need to do a lot more to encourage and enable school children to walk and ride to school. In WA, there's a Safe Active Streets program, and in Queensland, there's a Ride School program that's facilitated through We Ride Australia, and again, together in partnership with local bicycle groups and councils.
Yeah, they're really great initiatives. I love that idea of closing off the streets. I mean, I guess it's about also helping kids to become more confident, just street aware without having to navigate the difficulty of cars, just while they get their confidence. It's a really great initiative. We've touched on, between us both, some of the measurable benefits, but I really love all the benefits like that come from the research. So can we talk a little bit more about, I guess, the measurable benefits, health or economic, that local businesses or communities are gaining by prioritising walkability in their planning?
Yeah, for sure. So Belinda, any one of those case studies on Healthy Active by Design has information about the measurable health, economic, social and environmental benefits for that particular project. So there's a wealth of information there. And again, these really, really good examples for other practitioners and councils who might be thinking of embarking on similar sorts of projects across the country. But an example that I really want to highlight is actually an international one from Oklahoma City in the US, where early in the 21st century, Oklahoma City was well considered to be one of the most unlivable cities in the US. Walkability had been neglected. Obesity levels among the local community residents was quite high. It had the highest density of fast food outlets in the country and also one of the lowest life expectancies. The mayor at the time, a guy called Mick Cornett, who was himself obese, decided that he wanted to do something about this situation. And this speaks to the level of influence of our elected leaders and the opportunities that they have to reshape their built environments. So the Mayor, Mick Cornett, challenged his community to join him in collectively losing £1 million in weight. And he used the rallying cry, "This city is going on a diet." But he realised that dieting wasn't going to be enough alone to turn that city around and to turn around the health and livelihoods of those community residents. So what he then did was push through a 1% rise in city sales tax to fund a redesign of the city streets and spaces to provide better health outcomes through improved walkability. So through that tax and the funding that was made available, hundreds of miles of footpaths, bike lanes, trails, and a walking-friendly CBD were developed. And this really had a huge transformational effect for the city and the community. It really did get people more active, and it really does demonstrate the outcomes of having a more walkable built environment. If you build it, they will come. It almost speaks so clearly to that old metaphor. And the city has since gone on to win a place on the list of the fittest cities in America.
Oh, that's a great story.
It's a really, really great case study, that one, and really does demonstrate some clear outcomes from improving the walkability of one area.
And you're right, like when, really what elected representatives can achieve when they put their mind to it, they can actually take the whole community with them on the journey.
Yeah, absolutely.
Well, let's look at a bit more of like comparisons. So how does the Heart Foundation think Australians rank in terms of physical activity and active travel when compared with their international counterparts? How are we doing?
Yeah, Belinda, look, unfortunately, we are not doing too great. And even beyond the Heart Foundation ourselves, the World Health Organization ranks Australia 97th of 168 countries for self-reported physical activity levels.
Oh, it's not good, is it?
So we've got it's not great. The positive is there's room for improvement. We know what needs to be done. We need to do it. Our ranking now from the World Health Organization is roughly in line with countries like Austria, the Maldives, Tunisia, and Turkey. Some examples of countries that fare better than us include Uganda, China, and Canada and Mexico, as well as another 90-odd countries who do fare much better than us. So look, coming back again to some of those key stats that we spoke about at the start of this conversation, and I think it is worth reiterating in this context, is that 4 in 5 adults in Australia don't meet physical activity guidelines. And that's those 30 minutes of moderate level physical activity most days a week and strength exercises. And that physical inactivity continues to be a major driver of chronic disease, including cardiovascular disease. So it really is something that we need to address and we need to do better. We've spoken just a little bit now around children and active travel and highlighting just why active school travel programs are so important. In 2022, the Australian Report Card on Physical Activity for Children and Young People rated our national active school travel levels a D+ in Australia. And this is a score that has been maintained since our first report card in 2014.
Wow.
So we're not doing well. And this represents about 1/3 of children and young people who usually use an active mode of travel on the school journey for at least part of their journey. So it's only 1/3 of children. And these rates have been declining since the 1970s. In the last 40 years, these rates of active travel to school have declined from 75% to now just 25%. So that's a little bit embarrassing.
Disturbing.
And there are a number of different barriers that we know about that's leading to some of those very low rates of active school travel. And this is where I would refer again back to our evidence paper on active school travel and some great research that's being undertaken by academics across the country, as well as those practical projects as well from councils like Mary Beck, who are really working so hard to try and change those statistics in a much more positive direction. Another example there, Western Australia's Department of Transport has developed an active travel to school roadmap through to 2030. That's one initiative from a state government level to help reverse the declining rate of walking and riding to school. So look, it's encouraging. We know our stats aren't good. We know that we need to do more. We know that there's room for improvement. It's a matter of action.
Yeah, and, if we can get on top of this at the school level, then that is going to be, I guess, a way of life that is then going to carry through with those kids all the way through. So
absolutely,
concentrating on that, the children's sort of youth, I guess, demographic is just so important.
Absolutely. It's a generational change that we need to see.
Yeah. What I know you've conducted just recently the What Australia Wants national survey. What did that reveal about Australians' preferences for walkable and livable neighbourhoods?
Yeah, thanks, Belinda. It revealed quite a lot. It's a survey that we have undertaken twice previously, and in February and March this year, the Heart Foundation engaged McCrindle Research to update that survey. And it's a survey that basically asks questions about physical activity and sentiment for local neighbourhood design. It captures qualitative and quantitative data, and as part of this year's survey, McCrindle Research spoke to 3,000 people across the country. And those survey findings have really reiterated some of what we've spoken about during this conversation around the important role of built environments in influencing physical activity, and that many people in Australia really do rely on their local surroundings or their daily commute to incorporate physical activity into their routines. The survey also found that overwhelmingly, people in Australia want to live in neighbourhoods that do support them to be physically active. And this was represented across 93% of the results that came back. So that's a pretty staggering, overwhelming majority and a very clear message to local councils and practitioners across the country. The survey also revealed key insights into specific features that people value within their local neighbourhoods. And what we heard, unsurprisingly, is that connectivity and maintenance of footpaths is really, really important to people, as well as having easy access within walking distance to a range of daily destinations and services, having a sense of place and community, as well as a sense of safety. And we also found that when deciding where to live, survey respondents considered the proximity to destinations is a top priority for them, including access to fresh, healthy food. Some other really great stats that have come out of that research is that 66% of survey respondents want the government to redirect some roads funding into active transport and public transport. So that's really encouraging. Another really encouraging insight is that 65% of survey respondents are in favour of governments reducing speed limits in neighbourhood streets. And look, more broadly, the survey responses are encouraging for local councils and for elected leaders. Overall, we heard that there were relatively strong levels of satisfaction with local neighbourhoods, and that most survey respondents indicated that they believe their local area enables them to be physically active. But while we still have these really low levels of physical activity and people getting out there and walking and other forms of exercise, we know that there is still more to be done. So the key insights from the survey can be leveraged to inform priority action areas for all levels of government. The report itself also serves as a really great advocacy tool as well, and we at the Heart Foundation will be using it for that purpose for many years to come.
Yeah, no, it's fantastic research. We've talked about the Healthy Active by Design program. So let's just turn and talk about the other important program, which is sort of really geared to community members, which is the Community Walkability program. How does that encourage local residents and encourage grassroots action to improve neighbourhood walkability?
We believe that community members themselves have a really important role to play in taking action at that local level and advocating and adding their support and voice to support the actions that all levels of government can take to make local neighbourhoods more walkable and livable. So to that end, we've recently released a range of different resources specific for community members. As you say, most of what we've spoken about to date is very much focused on industry practitioners and elected leaders and decision makers. But for community members specifically, we have a whole separate web page that sits on Healthy Active by Design. And we've developed a number of different fact sheets that help raise community awareness and education about all these things that we've been talking about today. You know, most people, it doesn't necessarily occur to them as part of their day-to-day life, the role that built environments have in shaping their levels of physical activity and the walkability of their local neighbourhood. So we want to raise greater awareness and education about that role of the built environments and how it relates to a person's heart health as well, of course. We've got a community walkability checklist, a petition. We've got a list of suggested activities that community members themselves can take to improve walkability in their local neighbourhood. You know, it's not always just the responsibility of local council and other governments. You know, a community member, it's something like a little street library, a water bowl for dogs. These are all simple little actions that go a long way to improving walkability. We've said it's not just the footpaths, it's some of those other attributes that help create a sense of place and a sense of community and safety. We also have an interactive community walkability map that I'll talk about in a little bit of detail. But just firstly, our community walkability checklists, so these are similar in some ways to the checklists that we've been talking about for industry members, except they are a bit more condensed, written more from the perspective of a community member to be able to pick up this checklist and go on their local walk in their neighbourhood and undertake an assessment or audit of a range of different walkability features. So yes, it looks at the condition and maintenance of the footpath, shade canopy, availability of public seating and toilets, and a range of other community amenities and facilities. Once a person completes a checklist, they receive a PDF copy of their checklist that they're able to share with their local council. They also receive a walkability rating of just how walkable their area is. So it provides a bit of a benchmark. And again, that opportunity for someone to advocate and to start thinking, oh, my area isn't perhaps as walkable as I thought it might be. There are improvements that I'd like to ask to be made. As opposed to the checklist, the petition is a really quick and straightforward way that a community member can add their support for more walkable, livable local neighbourhoods. It's also a really powerful way for a community member to effectively partner with their local council and give their voice and support to their local council in advocacy efforts from the local council to the state and federal governments. And the interactive map that I mentioned, this one is one of my favourites. We engaged a software developer, Jake Coppinger, who's based in Sydney, to develop an interactive community map for us. And we are so pleased with the work that he has done here. The map is fun. It's also educational, informative. It has an advocacy element in itself as well. Basically, the way the map works, it's on our website. A person can drop a pin. They can select a 5, 10, 15 or 20-minute walking catchment, and the map will populate with a list of destinations that are within that walking catchment.
Fabulous.
It's not just a radius. It actually looks at the availability of footpaths and walking infrastructure on the ground. A really clever thing that Jake has done for us with this map is there's a toggle field that looks at how that walking catchment could expand if the traffic lights were reprioritised towards people walking, so that if the traffic lights reduce the wait time of somebody waiting to cross a road, what does that do to the walking catchment? So that's also a really fun and informative toggle field there on the interactive map. It's great for community members. It's also great for council and others. And we hope that not only is it education and fun, but it will hopefully also inspire behaviour change if somebody can see that their local shops, that they need to perhaps drive a circuitous route to access, and it gives that perception that the shops are a long way away. If they walk there, there are potentially cut-throughs and laneways that they can take as a person walking that mean that those shops are closer than they might have otherwise thought. So, so some really great resources for community members.
Yeah, no, that sounds really great. Tell me, within the councils, is there generally somebody that I guess has been entrusted with implementing your work? So when community members are, I guess, sending off their PDF of their walkability checklist, is there somebody that is coordinating the work?
Not at the moment, no. And it's early stages for us as we have only just released these new resources. And this is the first time that we've got a digital checklist. So it is great that the process is now semi-automated. But at this stage, no, we don't have specific touch points in each local council.
Is there one state government in Australia that you feel is leading the charge for ensuring positive health outcomes are integrated into urban planning decision-making?
Oh, that's an unfair question. I hate to pick favourites.
Oh, no, go on.
Look, there are lots of great things happening across the country. I probably would give a shout out here to Vic Health, who have a whole team on healthy built environments. So that's a fantastic initiative and shows really strong commitment from state government at that level. But I also know there are brilliant things happening within the health team in Northern Territory government. It would be remiss of me here in the ACT not to mention that ACT government has health and wellbeing indicators incorporated within their budget process. So no business case can go through government without an assessment on health and wellbeing indicators. So look, there are lots of great things happening across the country. Of course, New South Wales has the Movement and Place framework. They've recently released an active transport health tool to help assess the health and economic benefits of active travel infrastructure. And there are great things happening in every state and territory, but there are a few that come to mind.
Yeah, I thought it was pretty good in WA, where the state government's mandated that all local governments have to have public health plans in place by June next year. I think that's a really great initiative as well. So it's good to see that yes, things are afoot, and that you are fueling that action from getting everybody moving in many different ways.
Doing what we can.
Both in a policy sense and in a physical sense. So congratulations. Yeah. For listeners who are interested in improving walkability in their own communities, I guess what practical steps or actions would you recommend? Would you recommend them to get on board with the community walkability program that you've just been speaking about, or is there another way they can get started?
Yeah, look, for local community members, definitely jump online, have a look at some of those resources, share them with your friends and family. I think one of the really important things that can be done is just helping to create that awareness and education about just how important walkable built environments are, how important they are, and also what they are. What does a good walkable local neighbourhood look like? And also the importance of community advocacy. I think as humans, it's often always a last resort when we start talking with local councils and elected leaders, and it's not until something goes wrong. But I can't emphasise enough the importance of positive, proactive, constructive conversations and advocacy and support with local councils and elected leaders. Get behind projects that you want to support. Let your elected leaders and local councils know that they have your backing to be able to proceed with projects. Don't just, if something is being proposed and you support it, don't be quiet. Speak out. Let them know they have your support. I think that's really important.
Yeah, I really echo that. Too often with community consultation, people only speak out when they've got something to object about. And yeah, I always encourage people as well to speak out if you support something, because it is so important.
Yeah.
And sometimes it's the people speaking out to support something is the thing that gets it across the line.
Yeah, absolutely.
Well, and I might bring our podcast to a close, but thank you so much for joining us today and sharing the work that the Heart Foundation is championing. My grandmother always said your health must be your number one priority, and she was right. And it's clear that as custodians of the built environment, we all have an important role to play in ensuring our design decisions deliver the best possible positive health outcomes. Thanks to the Healthy Active by Design program and the Community Walkability program, we can all now access the resources that we need to guide the decision-making and to lead the important community conversations that are required to orchestrate change. So thank you very much to you and your team for the enormous effort and the heartfelt passion that goes into what you do on a day-to-day basis.
Oh, look, thank you, Belinda, and thanks so much for having me today. It's been a really great opportunity.
No, it's been our pleasure. If you have any questions or thoughts to share, click the link in our show notes. We'd love to hear from you. And if you're a developer or working on a project that needs an online presence or stronger community engagement, reach out through the same link. Alternatively, you can visit urbantalk.com.au. Don't forget to follow, leave a rating and a review. It really helps more people find the podcast and keeps the conversation going. I'm Belinda Barnett, and thank you for listening to the Urban Talk podcast.